So good morning, everyone. Thank you very much. I'm sure a few of you, I've seen a couple of names here, so you've probably heard you've heard this before, but thank you very much for your time on this Wednesday morning. And thank you for joining us here at the fifth of 6 workshops that we as the Dare UK team are holding, and this one specifically focused on the recommendations around access and accreditation. So what we're going to do today is we're going to start with a brief introduction to the program, which for some of you I know may be sort of the third or fourth time. But I think that for any of the colleagues who haven't been in the course before, we need to do that. So we'll start with an introduction to the program from Hans-Erik Aronson, who's the director of the Dare UK program. And then we'll move straight into our draft recommendations for the access and accreditation theme of our recommendations to UKRI, and that'll be led by Sushil Farmer, who is our technical lead. So I think without further ado, let's kick things off. And Hans-Erik, I'll pass the ball over to you.
Great, thank you, and you forward to share the slides, so it'd be great. Okay. Thank you, Fergus. Okay, thank you all for joining us today. My name is Hans-Erik Aronson. I'm the director of Dare UK Phase 1. Next slide, please. So Dare UK, the Dare UK program is a pan-UKRI initiative. The aim of the program is to enable a step change in UKRI or national research capability for secure sharing, linkage, and analysis of sensitive data for research and innovation, both at pace and at scale. It spans all 7 councils, as well as Innovate UK and Research England, so all entities of UKRI. Next slide, please. This is a multi-phase, multi-year program. It is split up into 3 phases. We're in phase 1 right now, which is an extensive program of community engagement with researchers, technologists, and the public, culminating in a co-designed blueprint for the next generation of trusted research environments with standards, access, accreditation, and ethics policies based on trustworthiness, security, and interoperability. This phase is followed by phase 2, which is a build, test, and establish phase, where we test out concepts that we are defining in phase 1. And in phase 3, then, we would deliver, optimize, and federate that approach, which is sort of the final phase of the 3-phase program. And the timelines of the phases are indicated in the left here. So the current phase ends at the end of August of this year, and at which time phase 2 commences and runs at this point. We plan for 1 year until September of 2023, when phase 3 takes over. Next slide, please. So what is the question that Dare UK Phase 1 is seeking to answer? Well, the question we're trying to answer is, how should a national secure interoperable digital research infrastructure and associated services be designed and implemented to connect and analyze complex, sensitive, often unconsented data from across disciplines and sectors in a flexible, efficient, and sustainable way? And I should mention that Health Data Research UK, HDR UK, and Administrative Data Research UK, ADR UK, were jointly commissioned by UKRI to undertake phase 1 of the program. The delivery team is based at HDR UK, but the program is indeed under joint HDR and ADR UK management. Next slide, please. So this journey is starting under a number of assumptions. There are outlined to the right here. We're not starting from scratch. There is a cross-council need for this approach. The federated infrastructure is technically feasible, and very importantly, that it's ethically and legally feasible to do this, and that it will be trusted by the public. And this motif of trustworthiness with the public is a key part of this journey, and we're very mindful about that at every time that we do this, at every juncture. And I should mention also that the funding and time envelope is assumed to be correct, and that we can actually execute this within the guidelines that UKRI has set, and that this is a sustainable approach to federated analytics of sensitive data. And finally, there is strong buy-in from the research councils, the government, the data custodians, and the researchers of this approach. Next slide, please. In the fall last year, we started off this journey with a landscape review. We did this in conjunction with Canal Ferrar, a data consultancy. We spoke to technologists and researchers and other stakeholders across the UK during this landscape review, and they identified really for us 6 themes that were of importance. And the workshops that we're holding right now are aligned to those themes. So you can see the themes in the right margin here. We are now doing the access and accreditation one today, and followed tomorrow by the digital research and infrastructure, which is the final workshop of these that we're conducting. Next slide, please. This phase 1 has a set of processes and deliverables associated with it. You can see the teal colored hexagons in the center. Those are the 6 themes that we have identified that we are conducting the workshops according to. We have the processes we're following is really public and stakeholder engagement. These are the darker blue ones at the top there. And a series of sprint exemplars that are being conducted right now. They started at the beginning of January this year and will end at the end of August. And it will inform our blueprint that we will deliver. Other deliverables that we will have is a detailed delivery plan for phase 2 and an outline delivery plan for phase 3, as well as a business case that makes this sustainable and fundable by UKRI. These are all things that we will deliver to the Digital Research Infrastructure Committee, which is a committee, pan-UKRI committee that we report to. Next slide, please. So DARE UK is a multi-phase, multi-year program. Again, you have the phases listed to right in the right margin here. It really serves the public, researchers, data custodians, and the TRE community. Those are sort of the key components that we need to address with this program that we need to serve. One more slide, please. This is the delivery team. I'm the director, and on the call you have all of the other members of the team here, with the exception of Lucy Gold, who's our finance partner, she's not on the team. No, she's not on the call, rather. So you have Jerry Riley, the design authority, Sushil Varma, technical lead, Michelle Amugi, which is our program manager, Fergus McDonald, our senior program manager, and Lizzie Wayne, our senior communications and engagement manager. I've included 3 links at the bottom here. This is a link to our website, the initial landscape review, as well as the sprint exemplar projects that you can look at if you're interested. One more slide, please. So just briefly, we're going to talk about trusted research environments. This is a key part of our what we're proposing here. And just briefly, these are basically safe computation environments that are guided by 5 principles: safe people, safe projects, safe settings, safe data, and safe outputs. I'm not going to go into this in a detail here, but basically these are environments where researchers can conduct research while the data is kept secure, and they can only see the appropriate data, as well as do only projects that are approved. And I have one more final slide, which is our house rules. These are our rules that they govern actually HDR UK, and they fall on to DARE UK. Transparency, optimism, respect, courage, and humility. And these are the house rules for the day, for our workshops as well. And if you would like to look at them in more detail, there's a link at the bottom of this slide. Thank you very much. I'm going to hand over to Sushil now. Thank you.
So good morning, everyone. This is the access and accreditation part of the presentation. I'll just quickly go through some of the recommendations that we've been eliciting from the community. And also I'll just give you a brief overview of what we're talking about. So I'm going to break it down into 2 parts: access and accreditation. So just as a heads up, so in terms of DARE UK, The aim is to try and design an national infrastructure to join up all the different research council facilities that already do digital research, and importantly, demonstrate trustworthiness to allow public and patients to come along for the journey and make sure we can support the high quality research so that we can benefit public and patients as well. So some of the draft recommendations we published last year, as Hans-Erik mentioned, we've had a large amount of conversations with our stakeholders, both within the national perspective, so all 4 nations, but also international as well. We've had discussions with the Swedish colleagues, Australian colleagues, and American colleagues as well, just to understand how they're going about building their own trusted research environments and what are the lessons we can learn from other countries as well. So the 2 key concepts that will be covered today, and I've purposely split this into 2, which is access and accreditation. Access itself is split into 2 parts. The first one is around requesting access to sensitive data. And what that means is when a researcher would want to access a particular sensitive data set, they need to submit an access request. How can we standardize and simplify that researcher's journey so that they can prove they're trustworthy based on the research credibility that they have, the kind of research that is of public benefit, the data that they're accessing, where they're accessing, and what outputs they're going to be generating. So that's a data access request part of one of the recommendations. The next one is around requesting access to the TRE itself. So this is, how do you log in to a system? You might think it's very trivial, but it's actually an important commitment that we need from the infrastructure to allow researchers to be able to bring their identity, be it from research organizations, from industry, from other organizations like the NHS, so that we can know who they are, what affiliations they have, and then they can get access to an infrastructure to access and process the previously approved data set or access other services that they have. So authentication is an important characteristic, and then accreditation of the user to prove that they have information governance training. So I'll go into the details in a few seconds. The next part, which is a big part, which is the accreditation of the TRE itself. And this is to define how do we define a TRE? What are the set of capabilities it needs? What are the set of governance policies and procedures and processes that they require? What are the roles and responsibilities of the TRE operator? And importantly, once you have defined the standard, how do you go about accrediting them, and how do we go about building an interoperable infrastructure going forward? So I've put the slide here, and I'm not going to go through all of these, but there's a technical glossary. We have a copy of this in the Jamboards later on. But in case if you're stuck of trying to understand what's the difference between authentication, authorization, accreditation, you can refer to this slide there. So without further ado, I've got 5 recommendations that we've collected from the community. The first one is provide a unifying user authentication capability to access services. And what that means is essentially what many of you have already been using Google single sign-on, Facebook, Twitter, all of that kind of nice stuff to access different services from multiple different sources. Again, just to emphasize, we're not emphasizing here that we need to use Google, LinkedIn, and other sources, but there are existing identity federations. So in the UK, research organizations subscribe to the UK Federation that allows them to access many university services and research services. Can we build and leverage those kinds of federations that already interoperate identities with each other? So if I was an employee of Embley BI, for example, in my previous organization, I could go in to University College London and access the Wi-Fi, can access services, library, that sort of thing, without actually going through an entire rigmarole of proving who I am, because University College London, Embley BI, and other organizations already trust each other. So how do we build that trust network in terms of federation and then be able to access various different services? The problem we have right now is it kind of works in research and academia, but we don't have a equivalent federation for industry. We are slowly starting to build a federation for the NHS. So how do we build those kind of different federations so that they can interoperate with each other and access services? So authentication to the service. Then leveraging existing industry and community standards. We built the Research Federation sort of almost 2 decades ago, and it's still very successful. But there are modern technologies, modern standards that we need to start allowing and leveraging to allow for maximum interoperability. The reason for that is if we can do that at a UK 4 nations approach, we will be able to build. Sorry. Yeah. Yes, it is. Yeah. Sorry. Yeah, I'm presenting at the moment. Can you just leave that one. Thank you. Apologies. I was going to apologize to somebody at the door at my house. This is somebody at the door at the seminar room. Leveraging international, the UK 4 nations approach so that we can leverage those standards both nationally and internationally as well. Science is global, research is global, so our ambition to build an infrastructure should be accessible for international research to benefit UK populations as well. And I think the core recommendation of phase 2 and phase 3 is to build a test case of identity federation authentication, both nationally and internationally as well. The next recommendation is to build a UK-wide legally conformant accreditation standard. What do I mean by a user accreditation? It means the process by which a researcher proves that they have undertaken information governance training, sensitive data handling training, the training that's a core requirement to access sensitive data. A lot of data custodians require this. There's a lot of existing regulatory authorities and accreditation frameworks in place already in the UK. The Digital Economy Act, which is used for administrative data, is widely used and widely recognized across all 4 nations, but it doesn't cover health. It doesn't cover other areas of data. How can we build? And there's the MRC regulatory guidance as well. So how do we build a network of these regulatory user accreditation frameworks so that we can share the workload, allow researchers, once they have gone through the information governance training and sensitive data handling training, it's recognized across all the different TREs, and have this in a 4 nations approach rather than a single nation approach that certain organizations provide. So certain TREs already do their own user accreditation training as well on top of the existing training and frameworks as well. So how do we harmonize that? And then develop consistent guidance for stakeholders to undertake user accreditation. This is both guidance for the TRE operators, for the data custodians, and for the researchers as well. So they don't have to go and pick and choose which accreditations that they need. There's a single guideline through which, if they do these 5 steps and undertake those certain training and certifications, they're able to get to a an accredited researcher status. And then I think one of the key smart objectives that we need for phase 2 is develop a user accreditation online training. We cannot do this in situ. The pandemic has showed us that we can do a lot of these things online. Can we do that at scale, a 4 nations approach, so that we can have on-site drop-ins to scale on delivery, but essentially we are able to undertake a lot of the activities remotely, because it's all about delivering courses. The Open University does this for 250,000 people. Why can't we use this approach? And there's also existing industries routes through Coursera and Udemy that will allow us to do this at scale. The next recommendation is a lot to unpack here, and I purposely kept it at a higher level, but we can unpack this in the further discussions and going forward as well. But this one is around developing an internationally recognized TRE standard and accreditation framework. The work that we're doing around trust research environments has already been internationally recognized. People are chomping at the bits to try and understand how we're going about defining a TRE and how we are setting up a federated infrastructure. But we have various different configurations of TREs that's popping up across the UK, and that's all right, because this idea has been around only for 2 years, and people are exploring the limits as to what constitutes a TRE. One of the things we need to do in phase 2 is to develop a working definition of a TRE, and try to get to a consistent standard definition. And we can highlight the edge cases where those standard definitions can be extended for various purposes. So a TRE for genomics, a TRE for longitudinal health, a TRE for sensitive data from transport or judicial data. So it's trying to define what is the baseline of definition of a TRE and how do we extend that. One of the things we need to do is also understand where those TREs are. Transparency in terms of findability of the TRE itself is hard to find. So I've got a scrapbook of about 60 TREs, but it's a scrapbook because some of them have not published their information online. Some of it is hard to find and it's hidden away in PDFs. We need to make that more transparent for public and patient benefit and trustworthiness, so we can understand what constitutes that TRE, what data sets are there, who's accessing the data, what outputs are being generated. And once we have those two things, we need to develop a framework to accredit TREs. And by that, I mean, kind of like a security standard. You go about and say, here's a standard for defining a TRE. Some independent authority would come along and look and sample all of the different governance processes and say, okay, based on our understanding of the standard and your implementation, we can give you a TRE status. And that is already leveraging existing frameworks. It's not trying to reinvent the wheel, but harmonizing, bringing those different frameworks together. There's a consistent approach of defining what is a TRE and how do we accredit them and how do we maintain a TRE and how do you expire a TRE status, so that not all TREs must last forever. There will be instances where TREs would have to merge and also decommission going forward as well. So one of the key recommendations for phase 2 is to implement and test this accreditation process for at least 2 TREs from separate domains. So we want to pick, health and non-health, or health and environmental data and judicial data. So separate domains, because the governance frameworks are slightly different, and it would be great to test that going forward. Recommendation 4 is one of the things that I mentioned in the very beginning in the key concepts is, right now, there's multiple different ways to request access data. It goes all the way from a Word document that somebody needs to fill in and send by email to somebody who will then process that request, all the way to a completely online end-to-end service that allow you to submit a web form with iterative approaches of updates to that data access request. That divergence of data access request procedures is actually very confusing, both for researchers, but also adds additional burden to the data custodians, especially when you have to request access from 2 different data custodians. So one who has a fully online service and one who has a Word document, that is incompatible straight away. And there's a lot of mental gymnastics you would have to do to try and work out what the researcher needs and what can be provided by the different data custodians. So can we leverage and harmonize the existing data access request procedures into a single baseline procedure? So what is common across all of them? And our assumption is what's common is the 5/6. So proving who requires access to data, for what project, what data do they actually need, where are they processing the data, and what outputs are they generating? And using that very simple 5/6 framework to allow us to harmonize across all the different data custodians and TRE operators would allow us to simplify the underlying governance process. So I want to hasten to add, this is not about harmonizing the underlying governance process of determining if that research project is good or not. This is about just requesting access to the data, the superficial part of allowing researchers a simplified route. This also allows us to build in a mechanism to make things more transparent. So identifying who you are using identifiers like ORCID that allows you to identify researchers, identifying funders and sponsors of the research, identifying who has the grant identifiers from and the UKRI councils, to ensure we can use that to publish this information transparently. So publishing data use registers as soon as it's approved, so that it's transparent and open to everyone to say, this person has requested this data for this purpose, and here's the outputs that they will be generating in due course as soon as the project is completed. So it allows us to transform both the input to a research project and the output to a research project, so that it's publicly open and transparent for everyone to use. And the last recommendation is it's a slightly more complex recommendation. But one of the things to assess a data access request application is understanding what is the privacy risk impact of any data access request. So individually, a data access request might have a particular privacy risk because they need access to de-identified data, but there could be some, the whole point of setting up TRE is to minimize risk, not eliminate risk. But the moment you start combining different data sets, especially at a longitudinal scale, when it comes from two different data custodians, or even at a multimodality scale where you're pulling in genomic data, or you're pulling in lab reports, or judicial data, or anything like that, education data, the privacy risk increases. So how do we assess that privacy risk? We need to have framework and a specification to allow data custodians to assess that objectively rather than intuitively. Right now, it goes through a set of processes that is uncoordinated. So each of the different TREs and data custodians have a privacy risk assessment framework with a risk register and everything else, but it's not coordinated. This is especially important if you want to do this at a 4-nation scale, when you have different jurisdictions getting themselves involved in a data access request, facilitating data access. So, and also then develop complementary guidance and tools to enable privacy risk modeling to see what good looks like and what is definitely a red line that we cannot cross. And then test essentially a smart for phase 2 and phase 3. Test the privacy risk framework as an ancillary tool as part of a real world project. So this is not replacing the data governance processes or the data protection officers, but this is a tool to enable them to assess the data access request itself, not as a replacement for the existing governance processes that the TREs would already have. And this sort of ties into the data access request, the privacy risk for the accreditation of the TRE, the privacy risk for the accreditation of the user as well. But this is slightly more complex, but I think we should be ambitious to be able to explore these 5 recommendations. But again, I want to open it up to you. If there are other things that we missed, if there are things that you want to add into any of these recommendations, chop and change, expand or reduce the scope, please let us know. And this is your opportunity to tell us where we may have got it wrong or where we think we need to go a little bit further. With that, I will stop presenting and I will hand you back.
Great, thanks very much, Sushil. All right, so we do have sort of a 5-minute slot, and Sushil, you are bang on time, so thank you for that. We do have a 5-minute slot for some, just some questions, general questions and clarifications before we go into the breakout rooms for sort of some deeper discussions. I'm going to pick some from the chat. So the first question here from Stella McLaughlin is user accreditation standard. Why not use existing ONS accreditation process? I'm not sure, Sushil, I could probably pass that to you.
Yeah, no, I think that's a great question. So I don't think we are saying we need to invent a new standard. This is much more about leveraging the existing standards that's already out there. So the DEA approved researcher scheme that they already run actually through the UK Stats Authority is definitely one of the contenders and one of the main contenders. So the question is, do we want to expand its scope? Because right now the scope is limited to only administrative data. Does it cover all of the different types of sensitive data? Do we want to expand that scope and say, look, that's the approach we need to take? There are already other things as well. So MRC runs its own information governance training. Can we link that in as one of the approaches? So we're not taking anything off the table. If the community, we want to explore this in phase 2. In phase 2, the community turns around and says, look, just do this. That's absolutely fine. We're not saying we need yet another standard. So for phase 2, we will explore what's out there, what's common, what's the leading option that we have, and use that as a recommendation to drive that forward.
Great, thanks, Sushil. I see there's a question here from Alison Knight. I'm not sure if maybe Alison, you can clarify it, but it sort of says, what about research with co-mingled purposes where more than one TRE might be relevant, for example, cross-health and non-health data linked analysis purposes? I'm not sure if there's a specific question there, Alison, if you want to clarify it, perhaps.
Yeah, thanks very much. Yeah, it's a very good presentation. I was just picking up on one point where the speaker was saying that, we might have one TRE for transport and one for environmental. But of course, nowadays with interdisciplinary data sets, and, it might be, and I was thinking specifically in health, you can categorize one thing as one thing in a perspective, but then in a different perspective, it could be, especially with commingled data, it could be a different type of thing. So I was just wondering about, is it that easy to really just say this is a TRA for transport or one for health? So maybe just a bit of an explanation around that.
Yeah, no, absolutely. And that's a good catch as well. I was definitely not leaning towards to have just TREs for a particular domain or even a particular region or locality. So there are different dimensions of this. We are already seeing TREs that are domain specific. We're already seeing TREs that are location specific. There are TREs that are jurisdiction specific, so England-wide or Welsh-wide. We need all of them. And there's definitely, so in the general sense, the national TREs would have commingled data, so environmental data, health data, and other forms of sensitive data. We need all of them. The point I was trying to make is what is common across all of them? What is a common set of capabilities that each of the different TREs need, regardless of what type of data that they have, and regardless of the spatial scale, the jurisdictional scale of that data, of that TRE. What are the common capabilities? We can sort of guess that through the 5 safes. So discovering data, so metadata catalog, single sign-on to be able to access data, data request access procedures, data use registers. So identifying what's common across all of them and standardize on that, and then allow certain TREs who want to extend to just provide genomic data services or general services, what are the extensions that they need to extend from that baseline? So at least you have some baseline mechanism to interoperate with each other and then extend into various different things. A common example I would use is the internet, for example, is a common baseline for all internet browsers to work. Each browser would provide different set of capabilities and functionalities, but underlying that is the internet, which essentially is a baseline protocol that everybody conforms to. We need to get to that baseline conformity to allow each TRE to provide exemplary or differentiating services on top of that baseline.
So I'd just like to take that on just a little bit further, Alison, because actually your comment is incredibly important. The real motivator for the DARE program is exactly that question of how do we do cross-disciplinary research on sensitive data. So the motivation for UKRI to do this was that we're pretty siloed, but we're pretty good within many of those silos at doing research within our domain, within our discipline, but we're not necessarily in a very good position, certainly not necessarily a world-class position, to be able to do cross-domain research. So the whole motivation for what we're doing here is actually how do we do this in a way that can enable that research on commingled data, be that TREs that involve commingled data, or be that actually research across data that might be in different TREs. So one of the reasons for looking at identity management is how do we get an infrastructure, a capability that can have identity management which we trust across different TRE environments. One of the discussions we'll have in tomorrow's workshop as we delve into the technical elements in a little more depth is going to be exactly how do we approach doing analysis across different TRE environments, in some cases where we can do federated analysis with the data in different TRE environments, some where we need to do some level of aggregation of data because it's just not conducive to proper federated analysis. So actually, Alison, the point you raise is actually fundamentally the core reason why we're running the program in the first place. So really useful one to raise.
Great, thanks Sushil, thanks Jerry. So I know there are 1 or 2 more questions in the chat, but just in the interest of time, I would just ask that we bring those into the breakout rooms and we can then have those discussions there. So I think with that, we're going to move into the breakout rooms where we're going to sort of have some smaller, deeper discussions on all of this. And please, please bring all your thoughts, questions, and energy to those. So Michelle or Lizzie, I think you can fire us all off into the rooms. So we're all back in, I think, in the main room. I did a hasty goodbye and thank you to my group as I got kicked off. Just want to make sure everyone's back in. All right, I think we have everybody back in. So what we're going to do now is we're basically going to just hand over to each of the, I suppose, your moderators for each of the rooms, and we're going to try to, as best as we can, capture some of the key ideas that came through in the discussions for the recommendations. I usually put myself on the spot here because I have the mic to start. So perhaps I will do that again. So in our breakout group, I mean, it was some really interesting discussion. I think a lot of it was, if I were to capture a lot of the feedback in one sort of sentence, it was, these are really big problems, and it's going to be hugely challenging to try to solve them. So that was a general feedback to a lot of the recommendations. I'm going to start maybe with the first one, and this is sort of around the unifying user authentication capability. I think really what was sort of recognized here, I mean, this idea, I suppose the idea of a passport with then different licenses within it that provide, you know, allow you access to the different environments is certainly a good idea. I think it was probably recognized that's quite a challenging thing to do under the surface, but certainly a good ambition. There was sort of discussion about, would there be different levels of access? So if you have this identity brokerage service, would it make sense to have different levels of access where you sort of have a, let's call it a, I don't want to say the basic level or standard level access, but then if you want to maybe, if it, depending on the type of data perhaps, or other factors, are there additional sort of levels of identity or levels of access that you need to be accredited for? So that was sort of two ideas that came through there on the first recommendation. I mean, the key message here also was, I should say as well, was that it has to take a look at what's already being done. So there's a lot of work being done already. There's existing processes, and it can't be, you know, it's got to consider this and more or less incorporate those in the work going forward. On the second recommendation around the sort of legally conformant accreditation standard, it's sort of, I think it was hugely challenging because there's, I think also on the legal side, it was sort of raised that this is also, there's a lot of gray area legally on sort of what governs the legal gateways to get access to data. And this also influences a lot of what happens in the accreditation process underneath. There was also the point about difference between an organizational access, so a legal gateway to organizational access versus a legal gateway on a user level rather than organizational level. I'm going to move along a little bit here just in the interest of time. So on the third recommendation, sort of quite a meaty recommendation on TRE standards and accreditation. I think there was a fair bit of discussion, but it's very much around this is a really big challenge, and there's going to have to be some real time put into understanding in really the detail how you're going to do this, and how you're going to set a standard, and then how you're going to accredit to that standard afterwards. I don't have actually too much more to add there. I think we were all sort of sitting there going, this is really a big one that we need to try and solve. On the DAR, so the fourth recommendation, data access requests, again, sort of the challenge here, I think, or the main point that sort of came out was the challenge is really when the interests are the same, you can harmonize DAR. So if it's a group of, let's say, data custodians who all have sort of aligned interest in an aligned domain, it's sort of more tractable. But once you start to move into, you know, different groups having different interests, it starts to very rapidly become difficult to manage all the requirements coming in and trying to actually standardize that. So that was one point here. And then we had a short discussion on the fifth one on the privacy risk assessment framework. Again, the message was it's definitely needed and probably an enabler for a lot of the other recommendations, but it's really a challenge. There's a lot of factors that have to be considered coming up with that framework. Okay, I'll leave it there. I'll pass the ball then to Hans-Erik.
Okay, thanks. Yes, we had a sort of a wide-ranging discussion as well. We had people from different domains, from high-performance computing from Iraq, for instance, and we had, which is one extreme of scale, and we have the smaller sort of TRE operators, and we had one person here, Lucy, who is setting up a new TRE in Sheffield, and we discussed the importance of making the journey easy for researchers, and how to bridge the sort of the tension of running a secure and lockdown environment while still making it possible for them to access data and at pace, and actually getting their research done without a lot of hurdles that are often opaque and difficult to navigate. In different areas of the recommendations, there are, so I guess we could say that one concern that was raised is, for instance, that we should be mindful of the smaller, say, SMEs, and not only talk to the larger health providers if we are looking in the health space. And I think that one thing that we are really mindful of, that I try to point out, is that we are looking for an interoperable, open standards-based environment where we avoid vendor or thought lock-in as much as possible. And that would also cascade over to the access and accreditation realm, that we not ride on a particular, say, commercial vendor to make that all happen. At least we have to be mindful about what ramifications are of that. There were some more technical things that came up in terms of how to do actual access governance of users, in a particular TRE, to allow external users to come in. But that it's somewhat domain specific. But in this case, they were relying on Microsoft's authentication environment, and that how you extend that so you can have better control of external users coming in. That can be a little tricky. But of course it can be done. It's just that you have to be careful how you set it up. For the second one, there are the points being made that some training material and courses are already available, and some TREs do provide that service. And is there a way to collate all in one place? So again, this thing of trying to make it more uniform across domains and TREs, and how are we going to align this this recommendation with existing TRE users and trainings, how to avoid users having to go through multiple accreditations. And that again is something that we hope to see a more seamless journey for the researchers. We don't have to be accredited multiple times. They did point out, for having a recognized TRE standard and accreditation framework, that there is the DEA accreditation, which exists for TREs currently, and that does enable access to multiple data sets from say, even health, but in some health data sets at least, and administrative data sets in conjunction. So say the ONS represents that. And for an extensible process to request access to data, the HRUK gateway is an example of that, and there are existing systems for storing and querying metadata, which could provide support for this. Lemur in Leicester is an example of that. This is sort of a similar process to the gateway, the HRUK gateway. And I think I'm going to stop there and hand over to Michelle.
Thanks, Hans-Erik. So we had some really great discussions taking place in our room. Particularly, one of the points that came out was that with these recommendations, the approach where the emphasis is on testing and piloting these on a smaller scale before then implementing the larger scale was really appreciated and valued, because, you know, one thing may seem accurate or worthwhile in theory, but in reality may be different. So that thread that has come out was very much approved of, that the idea is to pilot and test in as much as possible. With regards to recommendation 1, people did agree that that would be useful, and examples were given, for example, of CEL who accept ONS researchers, and that would be useful to look into why that is. Why have they made that decision? What is it about the ONS process that makes CEL accept their researchers? Because one of the challenges that people identified was whether or not organizations will trust users who are authenticated by others. So to kind of work out how to enable that trust would be important. There was a bit of discussion as well around exactly what this means. So how this user authentication work? Would it be in the process of a single sign-on? Would it be that people can have authorization straight away to access different data sets? And just to kind of make that a bit clearer in terms of what it is that we're hoping to achieve and to solve through having this unifying user authentication. For recommendation 2, again, agreed that that would be something very, very useful to have. And reference was made to the ONS accreditation system, and that could be, is useful and should be made more national, but also more efficient, because at the moment it is sometimes a bit time consuming for people to gain access. And that one of the ways to solve that would be that people can be approved or accredited ahead of time. So not just when they have a specific project in mind, but perhaps on an annual basis. And then that approval is not redone every time, but instead there's a top up available. So it's a case of, okay, you've got that accreditation, perhaps this training is needed to top that up, but it's not a case of starting from scratch every time. With regards to the training, it was discussed perhaps having a centralized place to offer that training and not having it run by employers, but instead in that central place where then people top up. So one of the challenges was, how do we make sure that users are accredited for the many different skill sets that are needed with different types of data? And so having that base level training and then those plugins and top ups to allow access to different types of data was a useful approach suggested. With regards to recommendation 3, again, just agreed that that would be really useful. That essential registry would be a great idea, but that the identity issue of linking the request to the requester might be a challenge. But if that could be solved, then it would be very useful. And that, again, there needs to be a base definition of a minimum requirement to be a TRE, and then plugins for specific data sets added to that. For recommendation 4, ideas was just to have standardized data access requests based on the 5 safes, and to make sure that there were accreditations for relevant data types within the TRE. So similar to that, kind of making sure that it can be adapted to suit the different TREs and data within them. And then lastly, just with recommendation 5, I think there was resounding approval in the sense that it is something that will be really useful and is really important to focus on. And just some ideas of good practice with the ICO and the plugins, and how, so just saying that we could refer to that to see how that could be rolled out on a larger scale. And I think I'll finish there and hand over to Jerry.
Thank you, Michelle. So I'm only going to touch on areas which my colleagues haven't already touched on. So around recommendation 1, there was obviously support for a authentication service, and that this needed to expand beyond academia to make sure it could encompass industry. We did have a very good discussion also about making sure it's a robust service, not only that you can provide access, but that it's can be audited so that we understand how that access gets used and also revoked. So we had some discussion. We also touched on the international aspects of this a little bit as well. So one thing that did come through is we also need to look at how this is done in other industries and domains. So there's some areas to be reached out to after the workshop today. Around a user accreditation standard, there was a view here that we do need an approach. It is a challenging and difficult area in how we cover the whole scope, but also to make sure that this is layered and consistent, and we don't sort of don't reinvent the wheel. Build off what already exists from organizations such as ONS, but also make sure that as you look at approaches to consistency, that doesn't become it doesn't reduce the rigor that already exists, so that there are organizations that have tried to look at this and to build out really good practice here. So we need to look at those and make sure that we don't either go for a bar that's so high around accreditation and conformancy that restricts research, but we don't dive to the bottom either. We've got something that's appropriate and layered, and that will feed a little bit into the discussion that we had with recommendations 5 when we get to it as well. Around TREs, we got captured quite a lot of interesting and important points. General consensus that we need to build on this. As we look at commercial providers, we also need to look at making sure that this can apply to the commercial providers, but also balances appropriately the need for trustworthiness versus where the commercial benefit is maybe coming from for them. So that needs to be captured. There was a really key point made here, in my view as well, that as we look at this accreditation framework for TREs, we also need to look at this across some of the recommendations that come out of previous workshops, so that we tie together the trustworthiness, the funding incentives, and the accreditation, so that we tie all elements of building a universally acceptable accreditation framework, but is properly funded with proper incentives and proper trustworthiness as well, and that we actually pull together those threads in the final recommendations. Do we need a standardized approach to 5 safes? And again, there was a view, yep, absolutely, we should have more approach. There was a view that the 5 safes have proven to be a great starting point, but actually, as we have some of these discussions, we perhaps need to possibly look a little bit at how we make a little bit more concrete about what we mean when we talk about the 5 safes. Sometimes they can be just a little bit too vague and nebula. So there was a perspective that they are a fine starting point, but actually we need to probably now, as part of building out this future recommendation, start to refine what we mean in a bit more depth, and just make sure that they fit well within the scope of what we are looking at for a network of TREs for sensitive data, that we actually have specific detail. And on the final one, there was real enthusiasm for establishing a privacy risk framework, so that we have a more consistent approach for decision making. The organizations don't have to reinvent this themselves, don't have to go into this and do the work. There's lots of people trying to do bits and pieces of this. And so there was really strong support for doing this, both to improve decision making, to allow us to have a framework that allows us to do continuous improvement as we understand more around risk analysis and also environments, data, infrastructure change, but also to help us communicate, not only improve our decision making, but communicate that decision making in a consistent language. So this recommendation had very, very strong support from the breakout room. So with that, I will hand over, I think Lizzie hasn't had the mic yet. So Lizzie.
Thanks, Jerry. I'll just very quickly try and add a few things that haven't already been mentioned. So one thing that ran through all of the recommendations was a sense that some of the challenges being discussed are technical, whereas others are more about hearts and minds. So kind of separating the two out and really acknowledging that they do have different resolutions to solve different types of issues that we're facing in that sense. There was agreement that generally all of the recommendations are necessary for and a prerequisite for more federated access to data, and that they're kind of key enablers of this. Just moving along. Again, agreed that it's important to kind of make use of what's already going on in the space, not duplicating. Really a need to help with interpretation of standards. It's not only that there are lots of different existing standards currently, but also that people interpret them differently, and that can lead to different policies, which can also sometimes inhibit research. So not only providing standards, but helping really to interpret those properly. Also, in terms of training, it was commented that it's really important to communicate why this is important. Obviously, people requesting access to data have the existing academic background. So what's this additional training adding? Just communicating why that's important. Sorry, just looking at the Jamboard here. There was a comment that it's important not only to standardize the requirements for data access, but also the timelines and the processes. Currently, there's so much variation in timelines for data access requests from weeks to years. So making sure that that becomes standard as well. Somebody mentioned three-stage Delphi process, which I thought sounded quite interesting for getting to an agreed set of principles. It was really acknowledged that a big challenge is finding a standard that different custodians agree with. At the moment, there's so many different data access requirements. How do we actually reach an agreed standard? So this Delphi process could be a way to achieve that. And I think I'll stop there to make sure that Sushil has time to speak.
So maybe Sushil, seeing as there's actually 2 minutes left on the official call, I will give you the chance, but for those who have a hard cut at 12, I just want to say thank you very much for joining us. But Sushil, go ahead, but for those who do have a hard cut.
And I can do this in 1 minute now.
Okay.
I think I'm not going to repeat everybody's comments, because I think our group is very much aligned to everybody's comments as well. So the only thing I would add in, so all the extra bits beyond what's already been said. So identity assurance level. So in terms of the recommendation one, the authentication, we need to try and enable different levels of identity accreditation. The one around accreditation standard, there was a point made by one of the attendees around modularity. So have a core accreditation framework and then modular things that you can add on as extensions to the core. The other one was around the TRE, very important point. I like the idea of in building a registry and then do that in an iterative manner. Again, all the points that you've said before, we had a huge yes for a recommendation 4, just do it. But again, we need to expand on some of the 5 safes because it's still at the very principal level. So we need to go a little bit deeper and get to. There's also a point about Singapore also using 5 safes. And the last one we didn't get to fully, but essentially they were reusing some of the standards that's already out there. There was a feeling that it's a little bit more complex than we can imagine. So start simple, and this recommendation has a dependency on everything else. So again, same points that everybody else raised as well. So apologies I couldn't get through all of the different discussion points because it's already covered in the other 5 breakouts.
Great, thank you, Sushil.
Hopefully.
So more or less that was, yeah, I mean, that was about 60 seconds. Thank you, Sushil, well done. So I'm aware that it is 12 o'clock and it is sort of the end of the call. Normally we would have a bit of a space, and we will have a space for questions if anyone wants to hang around and ask a couple of clarifying questions. So please feel free to say and ask those questions and listen to those questions. But for those of you who do need to drop out, we just want to say thank you very much for joining us. Thank you for giving us your time on a Wednesday morning. And I hope that we see some of you tomorrow in our final workshop. But if we don't, have a fantastic rest of your week, and we'll hang around for any questions or discussions anyone wants to have still. Thank you, everyone.